Good afternoon, everyone. I appreciate you all joining us on such short notice. We do have a lot to share this afternoon, so it may go a little longer than traditionally we go. Topping our press conference today will be some new MSDH guidance, new guidance from the CDC for the upcoming school year, an update on the Delta variant, and testing pop-up and county health department sites. We're going to talk a little bit about the transition there, and then we also want to talk about how we're working with providers. So joining us today is State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig. Dr. Dobbs, let's talk just quickly about where we're seeing a rise in cases. Dr. Byers will go into more detail, but let's talk about that and then go to the new MSDH guidance and why we're doing that.
Yeah, thank you, Liz, and thank you everyone for joining us. So we're seeing a pretty alarming increase in the number of cases, hospitalizations, and outbreaks across the state. And I know this is something we've discussed previously. We have seen pretty much an entire takeover of the Delta variant for our transmission. You know, we did predict a few weeks ago that the Delta variant would be the predominant strain circulating in the state of Mississippi, and we know that it's far more contagious than strains that have previously been identified in our state. And unfortunately, those predictions are becoming reality, and we're starting to pay the price for it. We've had a significant increase in our cases. We've seen increasing utilization of ICU beds, although the system's not overwhelmed, but we do have concerns about it going forward, like has been seen in other states. And additionally, we're seeing a lot of outbreaks. We're seeing a lot of outbreaks in youth. We're seeing a lot of outbreaks in summer activities, but we're also seeing a lot of outbreaks in nursing homes where we have our most vulnerable people. And because we're seeing this sort of confluence of risk, and because our collective under-vaccination in the state has put us all at risk, especially the most vulnerable. And at this moment, because of these risk factors, we are making the step of advising, of recommending anyone who is 65 years of age and older, or has a serious chronic underlying medical condition, to avoid any mass indoor gathering of any sort for the next few weeks. So through July 26th, if you are over 65, or if you have chronic medical conditions that would put you at high risk for COVID, even if you've been vaccinated, we want you to stay away from indoor mass gatherings. And you may ask, why are we doing that? Well, we have a lot of COVID circulating again, unfortunately, and it's pretty much all Delta. We know it's very contagious. It may have an increased mortality effect as well. And although the vast majority of cases we're seeing are in the unvaccinated, we still have a large part of our 65 and older crowd, about a quarter of the population that is unvaccinated. And we're also seeing some deaths in the vaccinated folks because we put them at risk, because we're exposing them over and over again. And also our people who are immunocompromised or people who have weakened immune systems. We know that they don't respond to the vaccine quite as well. So the other thing I'll say is, and we've said this before, if you have underlying immune issues because you're a cancer patient, because you're on immunosuppressive drugs, because you have dialysis, renal failure, or because you have any sort of thing that weakens your immune system, talk to your doctor. Take extra precautions because you're at risk, but talk to your doctor about getting a test to see if you have immunity, to check an antibody, and maybe even about getting a third dose, basically getting a booster dose because you didn't respond. This is a bit of an alarming time, but because so many folks have not taken on the vaccination to protect the state in general, we do want to make sure that those who are vulnerable have an opportunity to protect themselves. So, and Dr. Byers will go into it, it's circulating pretty aggressively through our younger age groups. And so if you're older and you have grandkids or you're around youth, be careful with those folks too, because there will be ongoing exposures when we have these sort of interfaces between, extended families. We'll give you the details of that again in a little bit, but basically we are recommending that in addition to our normal recommendations about getting vaccinated and wearing a mask in public, if you are unvaccinated, please, if you're 65 or older or have chronic underlying medical conditions, for the next couple of weeks, avoid all indoor mass gatherings. And I'll kick it over to you, Dr. Byers.
Thanks, Dr. Dobbs. And I just really wanted to provide some backup data for what Dr. Dobbs was outlining. Today we're reporting out an additional 416 cases and 2 deaths. And that's become more of the trend, if y'all have been watching it, is that our case numbers that we report on a daily basis are increasing. But remember that that's not the only piece of surveillance that we monitor. We also look at our hospitalizations closely. And I am going to share some slides for just a moment, just to kind of give you an indication of where we are with what we're seeing. So hold on 2 seconds. And so this is a representation of our hospitalizations over the last couple of 3 weeks. And you can see that we are having some gradual increases in the number of individuals who are hospitalized with confirmed COVID. You can also see that we've had a minimal bump in the individuals who are requiring ventilator use as a result of COVID infection. Now, these are not big increases, but you can see that the trends are continuing upwards. I think that's an indication of the fact that we are seeing more transmission. We are seeing more individuals infected and impacted. And again, these individuals that we're seeing are largely unvaccinated. We have seen a shift in our overall number of and proportion of deaths occurring in those individuals who are 65 and older, whereas earlier and through the mid part, and even more recently within the pandemic, close to 90% of our overall deaths were occurring in individuals 65 and older. We've now seen more of a transition to about 60 to 65% of our total deaths are occurring in individuals over the age of 65. And I think that that's an illustration in large part by the fact that we do have higher levels of vaccination among those groups. But just another illustration of the rapid increase in cases that we've seen over a short amount of time. For the first couple of weeks of June, you can see that we reported out a little bit over 1,800 cases. And you can see in this most recent 2-week period, ending July 7th, that we significantly increased the number of cases that are being identified and reported to the Department of Health. So again, the overall case numbers are an indicator. We haven't seen that same significant increase in our total number of deaths yet. But remember, the deaths often lag the increases in cases by a couple of weeks. And so we do anticipate with the bump in cases that we're seeing that we will see some concomitant increases in the overall number of deaths. And again, remember, as Dr. Dobbs indicated, these are largely among unvaccinated individuals that we're seeing our cases and deaths. Let's talk about the Delta variant for just a moment and what we have been seeing with our surveillance. Now, we have a total of about 150 total variant cases that are Delta identified in Mississippi so far. But just that number alone is not a really good illustration of what we've been seeing. And actually what we have seen is a rapid transition over to the Delta variant becoming the predominant variant of concern that's being identified in the state. This graph is an illustration of all of the cases that have been identified as a variant of concern in the state to date. You can see that beginning in early June and late May, we began this transition over to the Delta variant. And you can see that now the predominant variant of concern that we're identifying in the state is the Delta variant. And as Dr. Dobbs mentioned, we are starting to see pretty significant transmission of Delta that is very reminiscent of some that we saw in the early days of the pandemic. We're seeing more outbreaks and transmission occurring in church groups, in school and summer enrichment programs, in funeral gatherings, in the workplace, in other gatherings where individuals who are largely unvaccinated are getting together. We're seeing some residential care and long-term care outbreaks. And in many of these outbreaks, we have directly identified that they are the result of the Delta variant. And the transmission in those outbreaks has been pretty significant. This is another illustration of the proportion of variant cases that are now due to Delta that we have seen over time. And again, you can see how rapidly the Delta variant has become the predominant variant of concern that we're identifying in the state. Now, we do a significant number of samples that are evaluated for variant strains. And when we look at the total number of samples, positive samples, that we evaluate and sequence to determine if they are a variant of concern, we've seen some rapid growth in that as well. When you look in the early part of May through mid-May, the Delta variant was beginning to get identified in our total sequencing and made up about 2% of the total cases that were sequenced were actually identified as Delta. By the time we moved into late May and early June and into the first and second week of June, that number had increased to over 50%. And now we sit at about 80% of the total samples that are sequenced in the state are actually the Delta variant. And so just remember, this Delta variant is highly transmissible. It's highly infectious. And it's even more infectious than the UK or Alpha variant, which we identified earlier. Now, the good news is the vaccines are still effective against the Delta variant. But because of its transmissibility, especially in settings where the contact is very close and there are individuals who are infected, some of them may be unvaccinated, we can see transmission that occurs rapidly. This is just a quick snapshot of where we were by the 1st of July with our total cases, hospitalizations, and deaths based on their vaccination status. Again, you can see that 95% of our total cases that we've identified in the last month have been among unvaccinated individuals. 90% of our hospitalizations have been among unvaccinated individuals. Almost 90% of our deaths have occurred among unvaccinated individuals. But with these additional recommendations that Dr. Dobbs and the Department of Health are rolling out today, we want to continue to protect this most vulnerable population that, while fully vaccinated, may be vulnerable to infection because of the spread of this highly transmissible Delta variant. So another thing that I did want to share with y'all today, and you may have seen this, that CDC has rolled out their new K-12 guidance for the coming school year. Now, one of the big recommendations that CDC and really from the Department of Health that we've continued to say throughout this is that vaccination is really the key moving forward. So we want to make sure, and CDC's recommendations do outline this, that all eligible individuals, teachers, staff, students in the K-12 setting, that vaccination is still should be promoted and recommended for those individuals. But there are some other components to the CDC specific school-based guidance. We're reviewing that guidance now, and we will be updating schools with some Mississippi specific components of that guidance. That certainly there will be considerations for mask utilization for unvaccinated individuals. There will be some screening testing of asymptomatic individuals that will be a additional layer of prevention for those schools to identify and isolate anybody who's potentially infected. And then there's going to be the continued standard recommendations that will need to remain in place. The physical distancing under certain circumstances, appropriate ventilation, respiratory and cough etiquette, washing your hands, making sure that ill teachers and ill students are excluded from the campus setting, from the school setting, because we still want to, just like we did last August, make sure that we facilitate in-person learning as much as possible. And so, Dr. Dobbs and Liz, I'm going to turn it over to Mr. Craig, and I know he has a number of things to share with us as well.
Yes, thank you, Dr. Byers. And you know, as always, we have a lot of opportunities that have been created for testing for COVID as well as for vaccination throughout the state. We are seeing some increases in utilization of our COVID testing. So as we know, that is kind of a precursor to some of the cases that we'll see that may lead to some of those hospitalizations and others. So as you know, free COVID testing is available in all counties in the state of Mississippi. Most of that's through our healthcare partners and other entities, but in areas where the health department was able to provide testing when there was no free or no cost testing, we've done so by making testing available at our county health departments. So let me just share with you little information on that. This is the map of our mobile testing plan, and any of the dots that you see on this map represent areas, again, where there was little free or no cost testing available for COVID. And the health department has contractors that work in our parking lots at these particular locations, either 2 or 3 days a week, for a list of when those days are available at those county health departments. Again, you can go to our website at www.healthyms.com for more information /COVID. In addition to that, when you look at who should be accessing some of this free testing, you know, free testing is available right now for anyone who's symptomatic, anyone who believes that they're a contact to a case, for teachers, students, staff, administrators, any employees of K through 12, public, private, or parochial schools, as well as colleges and universities. In addition, we have free testing available for those that are in child care facilities and our licensed child care facilities in the state, as well as the fire, police, EMS, and other first responders in our agency. So any of these locations, free testing is available for those groups as well. If you feel that you have meet any of these requirements for testing and need to be tested, you can schedule that appointment at covidschedule.umc.edu. In addition to that, you know, we continue a lot of work around the state in our pop-up vaccination areas. Whoops, I'm sorry. And our pop-up vaccination is really in areas around the state for anyone 12 years of age and older. Again, we don't require any documentation. And second doses of vaccine are normally available about 3 weeks later. Get this share going again. I think the share may have stopped. There we go. So if we look at the upcoming pop-up locations, our first one is in Ashland, Wednesday of Thursday, Friday, and Saturday of next week at the Benton County Courthouse in Ashland, Mississippi. We'll also be in Lucedale at the George County Fairgrounds on Wednesday and Saturday, and in Bendale at their storm shelter on Thursday and Friday of next week. We look at Amory, we'll be at the Becker Community Center in Amory Wednesday through Saturday of next week. We'll also this Saturday, tomorrow, we'll be at the Corinth High School Gymnasium. We'll also be at the Okolona Auditorium, at the Itawamba Community Development Center, at the Marshall County Fairgrounds Building, and at Winston Medical Center in Louisville, Mississippi. So all these are additional vaccination opportunities that have been created around the state. Again, we try to also reach out to the homebound. We're in those communities. So if you're in one of these areas or anywhere in the state of Mississippi and are homebound and need assistance in getting COVID-19 vaccination, you can either send an email to covidhomebound at msdh.ms.gov or call us on our hotline, 7 a.m. to 7 p.m., 7 days a week at 877-978-6453. As Liz mentioned a little bit earlier, we are beginning a transition, both with the weather and the heat that we have in the state of Mississippi in operating our vaccine locations, but also our vaccination partners at the Mississippi National Guard will be ending their pandemic response on July 15th. So we're working to move some of our state walk-in locations to our county health departments. This week, we transitioned Panola County, Lafayette County, LaFleur County, and Neshoba County from their normal walk-in locations to county health departments. Next week, we'll be making transitions basically of the balance of our state walk-in vaccination sites. So by the end of next week, state walk-in vaccination sites will be transitioning to county health departments in all locations. You can see that today, Rankin County, Lauderdale County, and Pike County will be ending operations at the end of business today. So probably some of the best news is even more opportunities for vaccination in the state of Mississippi. Starting July 19th, part of this transition will be free COVID vaccinations available at all county health departments throughout the state. These will occur during our normal days of operation. To schedule the free vaccination ahead of time so that you can receive quicker service, you can make an appointment when you arrive. There should be same-day appointments usually available in most of our locations. Appointments can be made, as always, at covidvaccine.umc.edu. If you're thinking about hosting a vaccine event or you want some help in hosting a vaccine event, you can call our Mississippi COVID hotline for more details. And we would still like to continue to arrange more and more vaccine opportunities in the state of Mississippi. So COVID vaccination is available throughout the state of Mississippi, and we still want to encourage everyone to take advantage of these opportunities as much as possible. A couple other things right quick. We're working to enhance some of our provider campaigns and get more of our healthcare providers involved in a lot of our vaccination opportunities. And in doing that, there are a lot of reasons. We believe that physicians are a key part of our vaccination team, and that a lot of folks want to go see their doctor about being vaccinated. So we want to make sure that physician groups around the state have access to vaccine. Many are already part of our enrolled provider cadre, but for some of those, we've had some barriers in the size of the allocations of vaccine to their facility and just the temperature requirements and the number of doses that have to be received. So we've created some vaccine depots around the state of Mississippi where those vaccine providers, those physicians, can receive as little as a single vial to as many vials as they believe that they can use within a couple-week period, and we'll make those available to them. We'll have some more information out on our website in the coming days about those depot locations and how to gain access to that as well. In addition, those ordering physicians will have a link that will guide them to be able to order vaccine through what we call SurveyMonkey. It's just a tool that we use to be able to order the vaccine so that we can have it available for them ready to go when they arrive at one of our depot sites. In addition, our Chief Medical Officer, Dr. Dan Edney, is working hard to reach out to many of these providers. Know that we'll be happy to provide posters for waiting rooms and as well as important points for the various types of patients that might be looking to be vaccinated. And we want to make sure we can sign up as many doctors at major medical meetings and conferences as possible as we move forward in the days ahead. So we'll have some more information on that to follow, but for now, that's all I have. So Liz, I'll kick it back to you for questions.
All right, thank you, Mr. Craig. Appreciate that. I think two takeaways here is the people that are getting sick, the people that are especially being hospitalized and dying are the ones that are unvaccinated. Dr. Byers, you would agree with that, correct? Okay. And then also, you know, we get asked, well, what are we doing to, in fact, Jacqueline Massey's asking first, what are we doing to increase the vaccination rate? We are doing everything we possibly can, from making it available, making the vaccine available anywhere, and talking to more and more grassroots groups about getting their membership to get vaccinated. Right now, as Jim mentioned, we are working on the providers, and we're also going to have a focus on college age kids. Real important to get those folks vaccinated as well. So Jackie, if I didn't, or if you didn't get what you needed, just write me back, okay? All right, so I'm going to go to CJ with WLBT. Some people say, let me put my glasses on here so I can see this. Some people say they're postponing getting the vaccine because of medical procedures outpatient. In general, would something like that prohibit a person from getting the vaccine? Should people hold off on getting vaccine if they're going to be admitted for outpatient tests or procedures? I would say no, absolutely not. In fact, for many of those, they test you for COVID when you're going in. Dr. Dobbs, what do you want to say about that?
Yeah, you know, please don't delay vaccination. I mean, now's the time to do it. There's no reason. I mean, you may not want to do it the morning of, right? But if it's going to be a couple of days beforehand, even as soon as that, go ahead and get protected. There's no contraindication to getting vaccinated against COVID for outpatient procedures.
Thank you, Dr. Dobbs. Will Stribling from Mississippi Today is asking, how did MSDH decide on this list of guidelines? Why not recommend everyone mask in public indoor settings instead of just older folks and those with underlying conditions? Just trying to understand the rationale since they're just recommendations. So let's first go to Dr. Dobbs. Why these particular settings, and then the bigger question of why not everyone wear masks indoors?
Well, part of the recommendation is for everyone who's unvaccinated to wear a mask in indoor gatherings. So that is there. That is one of the components that is within our recommendations. But if you look at the complement of issues that we're facing, at this pace, and given the sort of external dynamics that are in play here, we're going to remain vulnerable for a long time. I don't think that we're going to have some miraculous increase in our vaccination rate over the next few weeks, so people are going to die needlessly. And so when we look at who our most vulnerable people are, vaccinated or unvaccinated, it's going to be the people 65 and older or who have chronic medical issues. And since we collectively can't do what it takes to protect the state as a whole, we want to at least give individuals the best guidance so that they can survive the COVID pandemic, so that they can get through this Delta surge that we're facing right now. People need to know that there is risk right now. And, you know, for the time being, if you're in one of these high risk groups, it is very wise for you to avoid indoor mass gatherings where we are going to see significant transmission over the coming weeks.
Thank you. And Sarah's asking, we do show a lot of slides and infographics. They're obviously available when we have our broadcast on the website. Sarah, write me back and let me know if that's good enough for you or if you're talking about something
And I
else.
think she wants Dr. Byers' fantastic graphics. So let's make those available. I mean, Jim's are good too, but she asked when Paul was presenting them. So.
All right. Well,
Yeah, we can make sure that we make those available, and we'll work with the team to be able to do that.
Yeah, I think we could put them definitely in where we have our news releases and where we do our news conferences, and as an accompaniment there, we could do that. So we'll work on
get
that.
Dr. Dobbs to tweet them as well.
Dr. Dobbs is quite the tweeter. Okay, let's go to Kobe Vance. How could the continued spread of the Delta variant affect breakthrough cases in Mississippi? And if there is a breakthrough case with the Delta strain, how severe is the illness? Well, we know we've had breakthrough cases with the Delta strain. Dr. Byers, why don't you go ahead and get that?
Yeah, you know, we've had breakthrough cases for people who are fully vaccinated, and we've been tracking those for a number of months now, and we've identified many of those cases. In many cases, we are able to obtain a sample from those individuals to determine what variant strain they may be. And certainly we've identified a number that have variant strains, both the UK or the Alpha variant. We've identified some vaccine breakthrough cases that have been due to the Delta variant as well. But remember, these are individuals who are vaccinated, and in large part, what we're seeing is that the vaccine is protecting against the severity of illness, which is basically what we've been saying all along. And so we don't see high rates of hospitalizations. We don't see high rates of deaths among those individuals who have vaccine breakthrough cases. By and large, they have minimal to mild symptoms and recover quickly. So even when an individual becomes infected after vaccinated, when they've been fully vaccinated, that vaccine also protects against severe infection, hospitalizations, and deaths. And that's a key component that we need to continue to promote is the benefits of the vaccine, even if you do become infected with one of these highly infectious variant strains.
Okay, thank you, Dr. Byers. Courtney Ann, I've been expecting your question. Dr. Dobbs, Congressman Thompson has said in recent days that Mississippi refused to take FEMA money to go out and identify vulnerable areas where vaccination sites were needed. Were there federal funds not accessed that you were aware of that could have helped the state's vaccine efforts? I just want to say before Dr. Dobbs says anything, we have used FEMA funds. We've been very privileged. We've also used federal funds through the Stafford Act for outreach. Dr. Dobbs?
Yes, thank you. Thank you, Courtney Ann. We haven't spoken with the congressman, and although I have seen that he's had some concerns, I'm not entirely certain of what they're referencing. But I will say that we've been fortunate to have really fantastic support from FEMA through the Stafford Act. It's been really sort of the bedrock of our operation since the pandemic took place. So I just want to really, give thanks to our federal partners for that support, because it has been critical. We've used it for really, pretty much every facet of our operation to some degree, whether it's immunization, testing, outbreak response, laboratory, PPE, communications. So we have benefited in our interface from the Department of Health from use of Stafford funds from FEMA. Yes.
Thank you, Dr. Dobbs. Jim, did you want to add anything, or are you good?
Yeah, no, the only other thing I would add is, in addition to that, the Stafford Act Fund has truly been a lifeblood for a lot of our operations during the pandemic, including as you look at these pop-up sites and all these locations that we've moved to in rural parts of Mississippi and vulnerable areas, that FEMA funding and that Stafford Act funding was key to our success in those areas as well.
And like I said, the Stafford Act funding has helped us doing several campaigns, reaching out, and certainly with our pop-up sites, that's the whole point, is to go to the rural high-risk areas where vulnerable populations are and may not have access to vaccine. We have Advika Anand, I hope I said that right, from the Northside Sun, and she's asking, since vaccines are still effective against the Delta variant, is Mississippi planning to incentivize vaccination in any way as other states have done? Dr. Dobbs, let's start with you on that.
Yeah, so that's a really interesting question. We have really been fortunate that a lot of our partners have taken on incentives as a mechanism. We talked to the universities yesterday through the IHL, and they've got some really great innovative stuff to try to make sure that kids can start college safely. Some of our community health center partners and other folks and businesses have done it. The Department of Health is really restricted from using our federal money for incentives. There are some sort of small, highly limited things we can do. So that really is kind of out of our hands. Other states that have done things have by and large done it with state money. And so, that's not something that's really certainly readily available to us. I will say that there's some debate about the utility of incentives. I know there was a recent publication that said that Ohio's incentive lottery didn't really make a difference, although I think the state of Ohio they dispute that. I think, time will tell, and as we use evidence, whatever evidence shows us goes forward. But, we're willing to support anything that can help move the needle on vaccinations. But pretty much the incentives that are happening right now are going to be through private businesses organizations that are able to do it through their operations, nonprofits, and that sort of thing.
Okay, and CJ, I realize I skipped that and was going to come back to you. What kind of communication has the governor's office had with MSDH as these cases increase? How confident are you that executive orders would follow these recommendations should cases and hospitalizations keep climbing at this rate? I'll start with you first, Dr. Dobbs.
Yes, certainly we stay in regular communication with the governor's office to make sure that they're aware of what's going on. And I've been in personal communication with the governor about today with the recent increase, and he's supportive of our public health efforts. We're not recommending any executive action. We're not recommending any mandates. What we're doing is we're providing personal recommendations for individuals who are at high risk for severe outcomes. We don't want anybody to die needlessly. People who've survived the pandemic so far thinking, hey, this is over, I can go to the Christmas party or the birthday party and drink a mimosa and catch COVID. Well, why don't we just wait a little bit? It's a bad moment right now. Please just be extra careful for the next few weeks. I mean, we'll give you an update. I mean, maybe things will be different in a few weeks, but for this distinct moment in time, we're at uniquely increased risk since we had the drop from the wintertime.
Thank you, Dr. Dobbs. Dr. Byers, how about taking Kobe's question? Are breakthrough cases prioritized for any kind of genetic sequencing to monitor for additional mutations of the coronavirus? Because we talked about how a lot of our testing is coming from the Jackson metro area. Could you talk about that a little bit?
Yeah, that's a great question, and thank you for that. We do prioritize vaccine breakthrough cases for sequencing. So we do ask that providers and laboratories, when they identify a positive sample on an individual who's been fully vaccinated, to communicate that with us. And then we work with that individual lab or partner to either get that sample sequenced through their existing lab or to transition that to one of our labs for us to be able to do the sequencing. That is an important component of our overall sequencing surveillance effort, but it's not the only one. We also obtain samples for sequencing from outbreaks and from community testing events as well. We don't want to just limit ourselves to those that are vaccine breakthrough cases, so that we can identify the larger spread of the variant in Mississippi. And this is the type of surveillance that we've had in place now for several weeks, which I think has been providing some representative overview of where we are in the state, and certainly is in line with what we're seeing nationally as well.
Okay, thank you. Advika Nan has another question. Has the health department drafted any ways to counter the spread of misinformation about vaccines, especially through social media? We have been doing that since our first COVID case. We do shows with grassroots people. We do presentations with grassroots people. We do presentations with groups like the Department of Ed. Like I said, the best way I think is the grassroots effort and spreading the word through partnerships. But we have Dr. Dobbs, Dr. Byers, Jim Craig, and Dr. Edney going out. Dr. Edney just did a show on vaccine myths. So yes, we have been dealing with that. Social media, while it's a good thing, also unfortunately has some downsides too, such as misinformation. But for every misinformation every piece we know about, yes, we do counter it with accurate information. And in fact, our first campaign we focused that entire campaign on myths and correcting those myths. So yes, we do, unfortunately. And Dr. Dobbs is always telling people, go to sources of accurate scientific information. So thank you for that question. Now we have Shalina from NPR. The governor has set the public health emergency to expire in August. How is that going to affect the health department? How is that going to affect what the health department will be able to do in terms of controlling a surge in cases? And do you think it's possible that the health department would be able to recommend protocols like masking, sheltering in place, since the state is basically open up again? So we did just do some guidelines, but issue some guidelines. But Dr. Dobbs, take the first part of that, if you would.
Yeah, so in general, I'll answer and let Jim sort of talk about the specific impacts on our operations. First off, let me say what a phenomenal response and support we've had from the Mississippi National Guard. I mean, absolutely heroic. Can't imagine the shape we'd be in without their support. So as they sort of cycle out, want to give them a big round of applause for their fantastic work. Of course, there's other players involved, and the state of emergency was instrumental in being able to access some of those resources. We do have other resources that should be able to maintain our efforts. The intensity of the vaccinations, the drive-throughs, these sort of like big ticket items are sort of no longer necessary. So it's not crippling that we're not going to sort of have that operation. There are some logistic changes we have to do as far as moving funding around and making sure that we're going more to normal operation mode. And I'll let Mr. Gregg respond to that to give some details if he'd like.
Yeah, no, thank you, Dr. Dobbs. And as we see in many disasters and other public health emergencies and other emergencies, there's a transition time between the state of emergency and more of a programmatic response where we bring things back in-house to execute those priorities that are still in need. I think we'll see the same thing in this one. Toward the end of August, when the state of emergency ends, our COVID unit will step up programmatically to begin to fill in those gaps. We've brought a number of contractors on in the days since we had the Mississippi National Guard, who have been, as Dr. Dobbs said, just excellent partners in so many of our activities in this particular response, as well as other agencies that were part of our pandemic response. But I think it'll just be a normal transition that we do to a COVID unit, and we'll have some surge capacity that'll be built into those contractors.
Thank you, Jim. And Max, one of my favorite reporters, not all the reporters are my favorite reporters, but Max, I've known a long time. If the pace of vaccinations does not increase, does the health department have a timeline for when health systems may become strained? What does the pace of vaccinations need to be across the state to halt this level of transmission? All right, let's see. Let's start. Health systems becoming strained. Dr. Byers, you want to take that?
No, that's such a good question, and I think that's an unknown at this point. I think we're going to have to watch that. Certainly, we need our health systems prepared, and I think that the recommendations that we're making right now are key to one of our primary goals, which has been throughout the pandemic, and that is to maintain healthcare systems capacity. And that's why we report that data. That's why we look at that data. We're certainly not at the levels that we were for hospitalizations during the worst time of the pandemic, when our healthcare systems were the most strained, and our healthcare systems really stepped up and participated in the system to be able to make sure that we had appropriate care available for all Mississippians in the state, regardless of whether it was COVID related or not. And I think that was a key component. And certainly, as we watch these numbers, we'll continue to work with those healthcare systems to make sure that, if there's additional recommendations that we need to make or additional actions that we need to take, that we'll communicate those effectively. I don't think that we're at that point right now. Again, if you look at the increases in cases and hospitalizations, it's relatively modest at this point. However, it is a disturbing and a concerning trend that we're seeing. We're certainly moving in the wrong direction, and we're in a warmer time of the season now where people are more spread out, and we are seeing a particular strain of the SARS-CoV-2 virus that's being readily and easily transmitted among unvaccinated people. I really think the take home in this is that now's our opportunity, and we've said this 1,000 times throughout this pandemic, and it sounds like a broken record, but now's our opportunity to again encourage Mississippians to take some action. We still have opportunities for those individuals who are unvaccinated to get vaccinated, to make sure that those individuals who are most vulnerable follow those recommendations and guidelines as outlined by Dr. Dobbs. And I think, again, we sit on the verge of a moment where we can impact change. I think we're just going to have to watch throughout these next few weeks how significantly our cases and our hospitalizations increase, and ultimately whether or not we see increases in deaths. But I think that we do have anticipation that over the coming few weeks we will see increased cases and hospitalizations as a result of the transmission that's occurring.
Thank you, Dr. Byers. So Rich Mendez with CNBC, what percentage of new cases, deaths, and hospitalizations in the state are vaxxed and unvaxxed? I think we had up some graphics for that, and we'll make those available on our website. And could the state's new guidance on 65 and over be expanded to other demographics in the future, Dr. Dobbs?
I don't anticipate that. I mean, because we're also including anybody with chronic underlying medical issues. And that's really going to be the majority of our deaths and a majority of our hospitalizations. Everyone has the choice and the opportunity to get vaccinated, and we hope that those who haven't will take the opportunity. At this time, we would not anticipate that action.
Okay, thank you, Dr. Dobbs. Isabel with the Sun Herald is saying school districts on the coast are largely planning to require unvaccinated close contacts of someone who tests positive for COVID-19 to quarantine for up to 10 days. But they're not planning to collect information on whether students and staff have been vaccinated, so it's hard to see how that will work in practice. And her question is, will MSDH recommend collecting vaccination status information so schools can ensure quarantine rules are followed? Will there be other guidelines on how districts should handle COVID cases and outbreaks on campus? And we did talk a little bit about guidance and how we'll be reviewing that and issuing some of our own. But Dr. Byers, would you like to take that second part of the question?
Yeah, I think, well, I can certainly take the second part of the question for sure first. And we've had guidelines out there that we provided to the schools and to the school districts since last August that outlined what the recommendations are for how school districts and schools should handle individual COVID cases and how they should manage outbreaks within their setting. Certainly, there are going to be modifications to that based on vaccination status. And there's been a recommendation now for quite some time that individuals who are fully vaccinated don't require quarantine, they don't require testing unless those individuals become symptomatic. So that will certainly be a component of our guidance moving forward, is to encourage that continued contact tracing, isolation of cases, identification of contacts who may be vulnerable, who may be unvaccinated, and recommend appropriate measures for quarantine and testing. And so we do anticipate that those guidances will be out soon.
All righty. Let's see here. Shalina from NPR is asking, are you seeing hotspots in the state? Where are those hotspots? Do they correlate to higher rates of unvaccinated individuals? I am assuming one of two things. Hotspots are either outbreaks or hotspots are places where there's low vax rates. But I'm wondering if Dr. Byers, can you hit that one for me?
I would encourage folks to review the county level data that we post on our website on a weekly basis that's updated. And certainly it indicates the counties where we are starting to see some increases. There are no areas in particular that stand out, although certainly we've identified, and we spoke about this on our last press conference a couple of weeks ago, that we had seen a number of Delta variant cases that were being transmitted among middle and high school aged children in the Jackson metro area that were largely associated with school sponsored extracurricular activities and enrichment programs. And I think that we're going to see this throughout the next few weeks. But I think when we think about where we're seeing the transmission, we're seeing it in group settings. We're seeing it in settings where people are gathering who are largely unvaccinated, who are staying in very close contact with each other. And all it takes is really one infected person to lead to transmission. So that's not necessarily in a particular geographic location. It's more of the nature of the type of transmission that we're seeing. And I really think that that's what people need to keep in mind, that they don't need to stay away from a specific county. They need to think about the activity that they're participating in. Who are those people around them? Whether or not they need to go to that based on the updated guidance that Dr. Dobbs reviewed. And certainly now's the opportunity again to get vaccinated to reduce your chances of having an infection that occurs as a result of one of those activities.
Thank you, Dr. Byers. Advika, I think we've answered that for you. And CJ, I mean, write me back if you didn't get what you needed. CJ, I think we got you taken care of as well, but write me back if you have anything further to follow up with. All right, this is Dan with Politico. Dan Goldberg, are there any vaccination efforts timed to the back to school season targeting the teenagers to try and boost those rates ahead of school starting and students heading indoors? Dr. Dobbs?
Yeah, and Dr. Byers has a lot of details. We're trying to set up vaccination sites for every school. If they want to partner, we're trying to make sure that's available. We're going to be offering vaccinations as part of our back to school drive for Arlo County Health Departments. So that folks come in, they're getting their normal shots. They can also get a COVID vaccine, or anyone can get a COVID vaccine. Also with the universities, they're really excited about having a great 21-22. They've had a hard couple of years with coronavirus, and they're ready to get back to normal. And the way to do that is to get as much of the student body protected with the vaccine. So yeah, it's not a Department of Health solo act, right? We have partners, and we're going to be available. I think it's pretty obvious that we'll do sort of pretty much anything short of donating a kidney to get vaccines out. But there are going to be more and more efforts, and a lot of it's going to be through the valuable partnerships that we have.
All right.
And Paul, if you want to add anything to that, I mean, I know y'all are working on the vaccination partnerships.
No, sir, I think that you covered it. And I think, our ultimate goal, in addition to having the vaccine available at our county health departments for those kids that are coming in for back to school shots, and certainly we want parents to take the opportunity for that, but we also recognize the need to have availability of the vaccines in the schools. And so we're working with schools now, and really our ultimate goal is to make sure that every school in an equitable fashion that wants to have vaccine for their students and unvaccinated teachers for all the eligible kids, that we are able to facilitate that they have those opportunities to have on-campus vaccinations for their kids. And I think it'll be a great thing for the parents too.
Thank you, Dr. Byers. Jim, did you have anything? Mr. Craig, anything you want to add?
No, I think they did a great job. But I know on the call that we had with IHL and a lot of the universities, just to reemphasize what Dr. Dobbs said, they were very, very excited about making vaccination opportunities for their staff as well as students as they come back to campus in August.
I think everyone wants to have a normal year, whether you're young, whether you're high school, whether you're college, and vaccination is the way to do that. Let's see, Steve from Super Talk. Hi, Steve. What is currently the most commonly used treatment for mild COVID-19 cases? And are there any treatment breakthroughs on the horizon? So Dr. Dobbs, why don't you start?
Yeah, no, thank you so much for asking. So there really are only a few treatments that are shown to be useful for outpatient use. And I would like for everyone to know that what starts off as mild COVID doesn't always end up as mild COVID, right? I mean, you have the infectious inflammatory phase, and then you have the inflammatory response phase that's usually a week or so later. So anyone who has COVID, who is over 65 or has a chronic medical condition or is overweight, needs to talk to their doc about a monoclonal antibody treatment. We know that it can reduce hospitalization by 75 to 90% and also can lower mortality rate significantly. Those are the treatments that we know are effective. There aren't any that are known effective. I know a lot of people are sort of fixated on ivermectin and hydroxychloroquine. I want to be very clear. The data is very strong that hydroxychloroquine does not work. The data is strongly supportive of the futility of using ivermectin. We do not keep docs from prescribing it, so it can be used off-label. I know there's some wacky websites out there that say that all these studies, and if you follow it, you see them, but I would like for you to dig in there and look at them a little bit better. It says that everything under the sun is effective against COVID. And if that were true, basically we wouldn't have COVID. So it's not scientifically valid, some of these things, but we don't prevent docs from using them, but there's no data to support them. And, and if we're not using science, if we're not using, real honest to goodness science to drive our decisions, then we're following voodoo, not, proper medical evidence.
Thank you, Dr. Dobbs. Holly with WCBI. When dealing with the more aggressive Delta variant, are booster shots going to be administered to those who are at higher risk? So we've talked about booster shots, I think, a little bit in our last press conference, but I guess I'll throw this first to Dr. Byers. I am wondering, first of all, about booster shots, and then, of course, with the Delta variant. What's the talk about booster shots at this time?
Yeah, boy, boosters are the hot topic these days, right? And they have been for a while. I think the evidence so far is pretty clear from the studies that have been conducted that there's still long-term effective protection from the current vaccines that are being utilized against COVID. And certainly it's been shown that they are effective against the Delta variant. Now, Dr. Dobbs did speak earlier that certainly there may be times when a physician may recommend a booster for their individual patient, for those individuals who may be immunocompromised or who have not mounted an appropriate immune response as a result of the vaccines that they've already received. And certainly that'll be those decisions based on that physician-patient relationship. But as far as an overall booster recommendation for a specific group or for the population as a total, I think we are still not at that point yet. Now, that's not a guarantee that we won't be at a booster point down the road, but I think that the vaccines that we have right now are still showing effective long-term immunity. Dr. Dodd?
No, I agree. I think that the booster conversation really ought to focus on those who are at highest risk of not responding to the vaccine. And anecdotally, in addition to some early studies, we've seen that people who are immunocompromised who get a third dose do, at some degree, manifest immune response. So I do think it's very important, if you do have a weakened immune system, to talk to your physician.
Hey, Jim, I see you shaking your head. Are you just agreeing, or did you want to add anything?
No, I just totally agree. And if in doubt, it's probably good in your immune compromise. It's good to have that conversation with your doctor.
Thank you. Okay, Cecil Hannibal with WAPT. Is there any guidance for the rise in RSV cases we've seen in the country? And is the pandemic playing a role in this rise? Dr. Byers, can you take that?
I sure can, and certainly, we were aware of the increase in RSV, and just a few weeks ago, we did notify providers that we had seen an increased number of cases of RSV among younger kids and in childcare settings and other settings, and that was actually seen across the Southeast, and really was kind of out of the normal season for when we would anticipate seeing RSV cases. It's usually a winter disease, very similar to other respiratory viral diseases. And it is possible that the preventive measures that we all took to limit the transmission of COVID, and that is, avoiding large gatherings, keeping our kids away from large gatherings, mask use, physical distancing, other prevention measures may have impacted the transmission of RSV that we would have normally seen during the winter season. And as those measures began to relax and we had groups of children who had not previously been exposed to RSV that was circulating at some low levels, we did see some increases. And, you know, we thought that we might see some similar increases with flu, because if you realize and you've watched the data, we didn't have much of a flu season this last winter either. And that was seen both nationally and worldwide, that in all likelihood, the measures that we put in place to prevent COVID prevented other respiratory viral illnesses from being transmitted as well. And so, you know, we did see a little bit of a bump, but certainly we haven't seen a sustained problem with RSV over time in Mississippi. So it may have just been some transient increases. We continue to watch it, look for those outbreaks and look for those clusters, but we haven't seen additional significant increases. But it's an interesting phenomenon to look at.
Thank you, Dr. Byers. Isabel Taft from the Sun Herald. Vaccination rates in coast counties are quite a bit lower than the state average. What are some of the reasons for that? I think we certainly have had vaccine availability down there, but Jim, I'm going to ask you about that in a second. And I guess Dr. Dobbs, Dr. Byers, any comments on that?
There's variability county by county. Local factors are very important. There's different subsets of the population that are more interested and less interested. The three factors that are most determinant in driving vaccine interest are age, so older folks. So where older folks live, you're going to have a higher rate. Education and income. So I don't know if there's any component of those factors that play a role, but there's just high variability.
Okay, Jim, talk about vaccine availability in that area.
Yeah, really since almost the beginning of our vaccination efforts, both in Jackson County and Harrison County especially, we had state drive-through locations there. We have some fantastic partners there with our Singing River healthcare system, as well as hospitals in the Harrison County area that have been part of the vaccination team early and often. And we're working to a large extent now with Hancock and Pearl River County to make pop-up locations more available there as well. But there's been quite a bit of opportunity for vaccination on the coast, and it continues to be. I mean, we're now back in the county health departments in both Jackson County and Harrison County, as well as Hancock and all of the counties in the coast. So the opportunities are still there for vaccination.
Yeah, it's a big challenge to get younger people vaccinated. I think you guys would all agree. But we're especially like that 30 to 40-year-old age group. That's real important, where we've seen some numbers, and we're hoping our college kids will, of course, get vaccinated before school. Kobe is asking from MPB, if someone has had COVID and got the vaccine after they recovered, how worried should they be about becoming infected with the Delta variant? We always want folks who have had COVID and got the vaccine after that. How worried should they be? I would assume it would have to do with being in a high-risk group, but Dr. Dobbs, will you start the discussion?
Yeah, so we do know folks who've had COVID before and then get the vaccine have a really good, robust immune manifestation. So they have strong immunity, but it's going to vary person to person. And so I think it's really dependent upon what your underlying risk is. So especially if you are immunocompromised, like we said before, we do think it's a good idea to talk to your doc. But if you have, other advanced problems, I still think it's worth being concerned because, 90%, 95% is not 100%, right? And so if we're looking at the moment in time right now where we are uniquely vulnerable to this highly contagious, deadly Delta variant that's circulating very rapidly throughout the state, it makes a lot of sense to take a little bit of extra precautions at this moment.
All right. Anybody else want to add anything to that? Okay, before we end with your one sum up statements, I wanted to kind of issue a challenge to the media. We've done tons of campaigns, and we know that people listen to people they trust, and also one-on-one conversations are important. So if you all could help us by interviewing people that have been vaccinated and asking them why they've been vaccinated and putting it out on your social media, and we would be happy to share it, that would be great. We could really use your help. We can't do it alone. So I would really love it if you all would help us with that. And on that note, Dr. Dobbs, most compelling statement as we exit out of this press conference.
I'd like to issue a challenge myself to everyone in Mississippi. And my challenge is this. If you are vaccinated, let people know. Let your family know. Let your neighbors know. Let your friends know. There's no more powerful message than trust, than faith, than for people to know how widely utilized the vaccine has been and understand that people are safe and excited to be protected.
Yeah,
My
that
second,
piggybacks, yeah.
my second challenge is if you are unvaccinated for whatever reason, I really challenge you to sit down and talk with your physician or provider and just ask the questions that you have. You're doing yourself a disservice and your family if you don't answer the questions that you have. Now's the time. There may be a moment a few months from now where you wish you had asked those questions and the outcomes may be irreversible.
Thank you, Dr. Dobbs. And I think that piggybacks nice on the whole misinformation that's out there. If you're not getting your information from a scientific source and you're believing misinformation, then please ask your physician or someone that you trust about the vaccine. All right, Dr. Byers, a compelling statement.
I would just remind us that we need to keep the main thing, and let's not get distracted. We still have the pandemic ongoing. We are still seeing transmission in the state and in the nation, and now we're seeing transmission of a highly infectious variant. We have opportunities. We've had opportunities from this point forward, and we have the tools in place now to be able to effectively limit transmission, and that's through our vaccination. And just, you know, we will eventually get to a point, and we're getting there soon, where you're either making a decision to be vaccinated against COVID, or you're making a decision that you're running the risk to become infected and have the complications that result from that, and ultimately transmission to your family. So I think we all have a decision to make, and that hopefully that decision is that we'll protect ourselves and protect our fellow Mississippians through vaccination.
Thank you, Dr. Byers. Mr. Jim Craig?
Yeah, so the other part that I would add is that, you know, while we've done a great job, I think, in vaccinating those that are in the high-risk group and those over 65, there's still a quarter of that population has not been vaccinated. That is our high-risk group. So if you're in that high-risk group, please take the opportunity. If you're homebound, let us know. We'll come to you. But please take one of these opportunities to get vaccinated. The Delta variant is just scary for a lot of folks, and for 65 and over and those that are high risk, it's something we want to make sure you're protected from. So please take advantage of any of these opportunities that we have and get vaccinated.
And I also want to thank our interpreter for everything she has done for us and everything they do for us at all of our press conferences. And thank you all for joining. On behalf of Dr. Dobbs, Dr. Byers, and Mr. Jim Craig, I'm Liz Charlotte, wishing you a good afternoon.